standing up, I'll take the chance to thank Dr. Gautam and the organizing team for inviting me to this Congress, and as well to see your beautiful country, as well as meet your wonderful people. And my topics is 2 and 3D sonographic evaluation of tubal abnormalities. The fallopian tube lies in the superior part of the broad ligament. It is 10 centimeters in length, and it is demonstrated with difficulty during pelvic sonography. It is usually visualized only when diseased, meaning filled with blood or pus or surrounded by fluid, as you can see here. Can you turn off the light, because they are mainly sonographic pictures and I need less light as possible, please. Disorders of the fallopian tube are a common cause of female infertility, accounting for 30 to 40% of cases. Tubal disorders include damage to or obstruction of the fallopian tube and peritubal adhesions. Thank you. Hysterosalpingography is the mainstay of evaluation of tubal patency, where laparoscopy is preferred for assessment of the peritubal environment. MR imaging can also aid in the non-invasive assessment of tubal dilatation and peritubal disease. Let's start with hydrosalpinx, which is the distal obstruction of the tube due to inflammatory process, surgical intervention, and/or peritubal adhesions. It can be evaluated by hysterosalpingography, MRI, and laparoscopy. As you can see here, some examples of hydrosalpingography and laparoscopy, and also with MRI imaging. What about ultrasound? We have evaluated the sonographic appearance of hydrosalpinx over a decade ago and described it as elongated sausage-like cystic lesions with thin borders and clear fluid and incomplete septa. The tubal mucosa is folded upon itself. Here you can see the incomplete septa. This is one of the most striking features of hydrosalpinx, with the tubal mucosa folded upon itself. Again, you can see here the elongated cystic structures with the incomplete septa here. This is a recent case. You can see, I'm afraid that there are too much light in here. You can't see the sonographic picture here, but this is an elongated cystic lesions with incomplete septa within it. Do you all see the sonographic imaging? Patel and al. Have evaluated the presence of the waist sign, referring to diametrically opposed indentation in the wall of the collection, as a diagnostic tool for hydrosalpinx. As you can see here in the asterisk, the waist sign. And they concluded that hydrosalpinx can be diagnosed with the highest likelihood when a tubular mass with a waist sign is encountered. What about 3D ultrasound and hydrosalpinx? This is a sectional plane of the hydrosalpinx with a axial, sagittal, and coronal plane, and this is called tomographic ultrasound imaging, TUI, when you have many slices of the lesion, and you can see the hydrosalpinx in many slices. This is the rendering view of the 3D ultrasound. You can see the hydrosalpinx with the waist sign in it. There is a special technique, three-dimensional technique called inversion rendering technique, which facilitates the diagnosis of hydrosalpinx. The acquired volumes, it was described by Timor et al., and the acquired volumes were inverted to display the cast-like appearance of the fluid-filled structures. As you can see here, many different hydrosalpinx evaluated by the inversion mode technique. This is the sectional plane. This is the rendering of the inverted rendering. And this is, again, this is the sectional plane and the inverted mode of the Hydrosalpinx. Here you can see in real time, as you can see here, the Hydrosalpinx here, and this is the inverted mode filling and evaluating the Hydrosalpinx. What about the contribution of color Doppler flow to the sonographic diagnosis of tubal abnormalities? We have found that in the periphery of the Hydrosalpinx, color Doppler flow revealed a mean resistive index of 0.75, while in the periphery of the tubo-ovarian abscess, an abundant blood flow with reduced resistance to flow was found, and it can contribute to the diagnosis of these abnormalities. Let's move. And since we are dealing with infertility Congress, Hung et al. Have compared the endometrial and subendometrial blood flow among patients with and without Hydrosalpinx, shown on scanning before IVF treatment, and they found that the proportion of non-multilayered endometrial pattern was significantly higher in the Hydrosalpinx group than in the non-hydrosonography group, and patients with the Hydrosalpinx had significantly lower endometrial and subendometrial vascularization index and vascularization flow index. Let's move to tubo-ovarian abscess or Hydrosalpinx. As you can see here, it has turbid fluid within the mass with thick borders with septa and abundant blood flow, low resistant flow, as you can see here. Again, you can see here the turbid fluid, the thick borders, and the abundant blood flow within the mass. Here is a very recent case for 2 weeks. 2 weeks ago, you can see here the tubo-ovarian abscess. This is the ovary. This is the fallopian tube. And this is rendering view of only the fallopian tube with the inverted rendering view, which shows only the fallopian tube itself. This is another example of acute Hydrosalpinx. As you can see here, the incomplete septa and the elongated cystic lesion. MRI can also aid in the diagnosis of tubo-ovarian abscess in doubtful cases. What about fallopian tube carcinoma? This is the least common cause of gynecological malignancies. There are usually no symptoms until the disease is well advanced. And Maliku et al. Have described a 50-year-old woman who presented with a 2.5 years history of vaginal bleeding and lower abdominal pain. And what they found here, as you can see here, the left fallopian tumor with solid papillary projections. Note the fluid inside the uterine cavity. This is a clue for tubal carcinoma. And you can see abundant blood flow with low resistive index within the papillary projection. Again, this is a case of tubal carcinoma. The first clue is the hydrometra. As you can see here, a large amount of fluid within the endometrial cavity, these two normal ovaries, and the mass between them. This is the tubal carcinoma.